Hello students, today we are going to discuss about cesarean section, and I think everyone is familiar with this topic. Okay, so normally the delivery will be happen through vagina, but that is like you can say artificial delivering of the baby. So let's begin. Coming to the introduction first. It is an operative procedure that is carried out under anesthesia whereby the fetus, the placenta and the membrane are delivered through an incision which is made on the abdominal wall and the uterus, and it is usually carried out when the gestational period completed 24 to 48 weeks. So what is the cesarean section? When the baby, placenta and membrane they'll take out through an incision which is made on the abdomen under the general anesthesia. And when we can do this? Once the gestational week reach 24 weeks and above. The first operation performed on a woman is referred to as a primary cesarean section, and when operation is performed in a subsequent pregnancies, it is called as repeated cesarean section. So when the woman undergo the first operation, first delivery of the baby, that is called as first cesarean section or primary cesarean section. But the mother is undergoing 2-3 cesarean section, then we'll call it is a repeated cesarean section. Next, coming to definition, it is an operative procedure to deliver the fetus through an abdominal wall and the uterine incision after the period of viability. So obviously it is a procedure where we are going to deliver the baby, and it has to be done under the anesthesia. Next we will see the incidence. Nowadays it is very common, and like everyone is referring this cesarean section, and hospitals, if you go anywhere you will say like more than normal delivery, cesarean section is more. The incidence of cesarean section is steadily rising. During the last decade, there has been 2-3-fold rise in the incidence from the initial rate of about 10%. Means it is increasing day by day. Factors responsible are increased safety of operation due to improved anesthesia, availability of the blood transfusion and antibiotics, and the increased awareness of fetal well-being and identification of the risk factor have caused reduction of the difficult operation and manipulative vaginal deliveries. So what happened means, why it is increasing? There are so many causes. That's why that rate of cesarean section is increasing. Like if example, if you say anesthesia, so normally the pain during the labor, as we know in our body, like together more than 50 bone break means how much pain will get during the delivery. During the normal delivery, the woman or the mother will suffer that much pain, so it is very painful. So if they undergo the cesarean section, the pain will be not there that much, because they are giving the anesthesia, they'll make it senseless. Okay, but it has a side effect in the future. But during the delivery, the pain no need to suffer. And sometimes what happens, depend on the baby condition also, they'll refer. If you go for cesarean, it will be good for baby well-being. And nowadays everything is, all the medicine, antibiotic, it is like available, so you can say it is safe also to go for cesarean section. So that's why everyone is going for cesarean section. That's why incidence is more. Now we'll see the indication for cesarean section. So we have categorized into two types. One is absolute, one is relative. Absolute means if you have this other condition, that you have to go for, must you have to go for cesarean section. And relatives means you can try for the normal also and cesarean, so that option is there. But in the first absolute, there is no other option other than the cesarean section. So in that first one, you can see vaginal atresia. What do you mean by vaginal atresia? It is a condition in which the vagina is abnormally closed or absent. So maybe the vagina is not there, or maybe it is closed. So this is one condition. Next one is advanced carcinoma of cervix, means cancer in the cervix. Next one is cervical or broad of contracted pelvis, or severe degree of contracted pelvis. Now what do you mean by contracted pelvis? See, this is also one condition. Okay, it is also anatomical condition. What happened? Normally the pelvis has some diameter, some length, some centimeter. Okay, in that contracted pelvis, some 1 or 2 diameter will be less compared to normal. So what happen, it is very difficult for the baby to deliver through vagina. So it can cause like so many problem in the baby as well as the mother. So they have to go for cesarean section. So these are the absolute cause. Now we'll see the relatives. First one is cephalopelvic disproportion. Now what do you mean by cephalopelvic disproportion? Okay, it is one small condition when the baby head or body is too large to fit through the mother pelvis. Okay, so compared to the baby size, the pelvis is small, so it is difficult to accommodate. So this is also one condition. Next, previous uterine scar, means if the mother has previously any surgery on the abdomen or uterus, that also is a like indication that they should go for again cesarean section. Next is fetal distress like asphyxia. Next one is malpresentation. Malpresentation means only cephalic presentation of the baby is normal. Okay, like head, when head will come in the first in the lower pole of the vagina, then we'll call it is normal position. Other than head, if any part of the fetus is coming first as a presenting part, it is called as malpresentation. So like first buttock is coming, or leg is coming, or foot is coming, so that for that is called as malpresentation. In that case also they should go for cesarean section. Next is antepartum hemorrhage. Antepartum means antenatal period, hemorrhage means bleeding. So during the antenatal time, if the mother is having any bleeding. Next one is elderly primigravida. Elderly primigravida means if the mother got pregnant for the first time after the age of like 30 or 35 above, then it is called as elderly primigravida. For them also going for normal delivery, it will be risk, so they will go for cesarean section. Next one is chronic hypertension, means high blood pressure, diabetes and pelvic atresia. So these are the some indication if the mother have, they should go for cesarean section. Now we'll see some indication, that is fetal indication. See first what we have seen, that is maternal indication. Okay, because of maternal condition we can go for. Now we'll see the fetal indication. What are the causes or what are the indication that we have to see if the fetus are having, then we have to go for a cesarean section. First one is fetal distress, I have explained. Next one is umbilical cord prolapse. It means umbilical cord will come first before the fetus come out. Next one is macrosomia, that is big headed baby. If the baby head is very big, it is difficult to go for normal delivery. Next one is placenta insufficiency. Same thing, the placenta will not have a sufficient place to deliver or to be in a attached to the uterine wall. Next one is multiple pregnancy. Multiple pregnancy means if there is 2 or 3 baby, more than one baby you can say. If there is no more than one baby, that it's called as multiple pregnancy. In that case also, that is good option for going cesarean section. So these are the some indication. Based on that you have to decide either mother should go for cesarean section or they should go for normal delivery. In this picture I am going to show you some indication. I have explained there are so many indication. Among those, just few I am going to give example. Just you can see this first, this one, 2, 3 baby. So this is multiple pregnancy. So this is the one indication. Then you can see this position, transverse position. Okay, so in that case also it is indication. Then placenta abruptio. What do you mean by placenta abruptio? Means if you see here, placenta is separated from the uterine wall, that is called as placenta abruptio. Next is breech presentation. Breech presentation means when buttocks is coming as a presenting part, we will call it is breech presentation. Next is placenta previa. What do you mean by placenta previa? Is placenta will come first, placenta will deliver first instead of baby, that is called as placenta previa. Now this is the picture for umbilical cord. You can see in the picture umbilical cord is coming out, or umbilical prolapse you can see. Next is macrosomia, big headed baby, and like normal fetus will be like this, yes, and large fetal you can see in the distress because of meconium. Meconium is that two stools that is passed by fetus. Okay, so last fetus in distress with meconium, that is oxygen level is less in the baby. Okay, you can say asphyxia. So these are the some example of picture I have shown you. These are the indication the mother should go for cesarean section. Now I am going to tell you some contraindication. In what cases the mother should not undergo cesarean section. First one, that the baby is dead. Second one, baby is too much premature, because in the premature cases they can try for normal delivery. If the baby is very small, no need to go for cesarean section. Next one is presence of blood coagulation disorder. Blood coagulation means difficulty in the blood will not clot. So if they'll go for cesarean section, the bleeding will not stop because they have some problem in the coagulation factor. So these are the some there are so many contraindications, but these are the some few are important contraindication. If the mother is having this other condition, they should not go undergo the cesarean section. So today only this much only remaining things I'll tell you in the next part. Thank you everyone.